Preconception and prenatal diagnostic technique, that is prohibition of a sex selection act 1994. Salient features: it was enacted in 1994 and subsequently amended in 2002. Aims: prenatal diagnostic technique for determination of the sex of a fetus were prohibited. The aim was to prevent female feticide. Advertisement of a prenatal diagnostic technique for the detection of or determination of sex were prohibited. Prenatal diagnostic technique for a detection of genetic abnormality were allowed. Some important definition. Dealt with the chapter 1. Chapter 1 A. Diagnostic procedures and tests are defined. Prenatal diagnostic procedures means all gynecological or obstetrical or medical procedures such as ultrasonography, fetoscopy, taking or removing samples of amniotic fluid, chorionic villi, blood or any other tissues or fluid of a man or of a woman of being sent to genetic laboratory or a genetic clinic for conducting any type of analysis or a prenatal diagnostic test for selection of sex before or after conception. That is section 2 2I. Section 2I. Okay. The prenatal diagnostic test means ultrasonography or any test the prenatal diagnostic means all gynecology, obstetrical, medical procedures such as ultrasonography, fetoscopy. To send it to genetic laboratory technique for conducting any type of sex analysis or prenatal diagnosis or selection of sex before or after conception, that is 2IA. Okay. Genetic clinic is a place where procedures are performed. Procedures, that is section 2D. It includes a vehicle where ultrasound machines or other equipment capable of determining sex is kept. Prenatal diagnostic technique includes all prenatal diagnostic procedures plus a prenatal diagnostic test, that is S2J. Prenatal diagnostic test means ultrasonography or any test or analysis of amniotic fluid, chorionic blood, or any other tissues of a or fluid of a pregnant woman concept is conducted to genetic or metabolic disorders or chromosomal abnormalities or congenital abnormal hemoglobinopathies or sex-linked disease. Sex-linked disease, that is section 2K. Genetic laboratory is a place where tests are performed, that is section 2E. It includes a vehicle is mentioned above. Taking a sample is a procedure. Analyzing it is a test. Both together are techniques. Ultrasonography is the only diagnostic which is included in both the prenatal diagnostic procedures and prenatal diagnostics test. Place 3 were different, that is genetic counseling center is a place which provides genetic counseling to the patient, that is section 2C. Genetic clinic and genetic laboratory are mentioned above. All 3 must be registered with the appropriate authority, that is section 18. In any case of any violation, registration can be cancelled, that is section 20. If the owner of this place wants to institute an appeal against order, it must be done within 30 days. Within 30 days actually. To the state government if the authority was in state level, and to the central government if authority was a central level, that is section 21. The fetal stages are defined as a concept as means a broad concept as means any product of conception or any stage of development form fertilization until birth, including extra embryonic membrane as well as embryon or fetus. That is section 2BA. Embryo means a developing human organism after fertilization till the end of the 57th day. Okay, following fertilization. That is end of 8 weeks. That is section 2BBB. Okay. Fetus means a human organism during the period of its development beginning on the 57th day following fertilization or creation, excluding any time in which the development has been suspended or ending at the birth. That is section 2BC. Okay. Next is regulation of genetic counseling centers, genetic laboratory and genetic clinic. Dealt with chapter 2. Section 3, only one section in this chapter. No person can conduct a sex selection. That is section 3A. No person can sell any ultrasound machine or imaging machine or scanner or any other equipment capable of determining sex of the fetus to any person or clinic are not registered under the section 3B. Regulation of prenatal diagnostic technique deal with the chapter 3. That is section 4 to 6. A prenatal diagnostic technique can be conducted only for a chromosomal abnormality, genetic metabolic disease, hemoglobinopathies, sex-linked genetic disease, congenital abnormality. Any abnormality or disease or may be specified by the Central Supervisory Board, that is section 42. Any of the following condition must be fulfilled before the technique can be carried out. That is, age of the mother should be more than 35 years. Okay. Pregnant woman has undergone of 2 or more spontaneous abortion or fetal loss. A pregnant woman had infection or be exposed to abnormal, potentially teratogenic agents such as drugs, radiation, infection, or chemicals. Pregnant woman has a family history of mental retardation or physical abnormality or spasticity or any other genetic disorders or any other condition, as may be specified by the Central Supervisory Board. Person undertaking the procedure must record the fulfilling the condition in writing. That is section 43. Okay. Next is informed consent. Okay. Prenatal diagnostic procedure can only be conducted after written informed consent, that in chapter 2. A copy of the written consent is given to the pregnant woman, that is section 51. Prohibition of communicating sex of fetus. Person conducting prenatal diagnostic procedure cannot communicate sex of the fetus to the pregnant woman concerned or any other person by means of section 52. Okay. Determination of sex prohibited. No person or clinic can determine the sex of a fetus or cause selection of sex before or after conception. That is section 6. Penalties on advertisement of any sex selection or sex determination technique, 3 years plus 10,000 fine. That is section 22. On sex selection or sex determination to a doctor, first conviction is 3 years plus fine 10,000. Subsequent it goes to 5 years plus 50,000 rupees. That is section 231. On conviction, name will be removed from medical registry for 5 years for first offence and permanently professional death sentence on second offence. That is section 232. To patient 3 years plus 50k for first offence and first 3 years plus 50k and subsequent offence 5 years plus 1 lakh for the second offence. That is section 233. The woman has compelled, she will not punished, section 234, but the person compelling her would be. Thank you.